Hi, I am Ernesto Carreon, a senior in the Global Health Honors Thesis program. I want to start off by asking, since when has being a size zero become a prerequisite for adequate healthcare and proper media representation? I ask this because my research focuses on exploring how exposure to weight bias stigma in media and healthcare increases depressive symptoms. Furthermore, how is it affecting the Latinx and LGBTQ communities with their help-seeking behaviors for healthcare? After an intense literature review, I have noted that when exploring the co-occurrence between obesity and depression, the methodology is very biocentric and inclines the research onto BMIs and PHQ-9s. I want to challenge that by inclining towards a stigma framework. Weight stigma is encountered everywhere, not just on social media or healthcare. It can be experienced in an educational, employment, and housing setting. The media industry often uses weight as entertainment content, and by doing so, it stigmatizes weight and spreads messages of societal discrimination and ridicule. This often leads towards individuals expressing feelings of blame and self-devaluation on social media platforms. Another environment in which weight stigma is encountered is in the healthcare. Healthcare professionals often use weight stigma as a medical intervention. This is based off a theory that using such will help the patient make healthcare eating behaviors. This stigma is often present in the physician-patient communication and leads towards messages of blame, rejection, and judgment. When we think about who is affected by weight stigma, we believe that overweight and obese populations are the only ones. However, my research has found that marginalized populations such as the Latinx and LGBTQ community are also at risk. This is because the same messages of rejection, blame, and judgment are intertwined with societal discriminatory experiences associated with the social determinants of health barriers that they face on a daily basis. It is fundamental to challenge the biocentric perspective within global health. With the COVID-19 pandemic we are living through, obesity and depression are increasing at an alarming rate. We must develop other frameworks to analyze health issues in order to make effective interventions. In this case, how can we create interventions to destigmatize weight? These interventions cannot just be made through a biocentric perspective. So to reiterate, why do we continue to use size zero as the prerequisite for adequate healthcare and proper media representation? Thank you.